how do you put this into practice? It's all very well talking here philosophically about we have to communicate differently with a chronic pain patient who's got all this baggage coming with them, particularly if it's been years in the making.
Yes. So how you put this into practice is that may differ slightly from practitioner to practitioner. The way I do it is I structure my questions in a way that ensures I don't miss things. I tend to get into too much detail myself sometimes and become quite narrow focused. So my structure, my way of question pages, it keeps that wider view. So how is we've got, well, seeking what they've come in for. You know, what are their main drivers now? Then it is, well, is this something that I can treat? So, you know, all the usual red flag safety questions. And then it's going into, okay, well, what is the tip of the iceberg of? I'm really exploring their background. So and what I might do there is start with just exploring, okay, you know, are they historically a sporty person? Have they been sedentary for a long period of time? What are their activities and drivers outside of this condition? You know, are they missing doing something? Those sorts of things are what I would ask. Once I've got an idea of that, it's then really exploring how sensitive is the condition. So, for example, is there any allodynia or anything like that? You know, what is the degree of that nociceptive drive that they're experiencing?
Right. Do you have some means of assessing that? Have you got a scale that you can measure it against for reference later, or is it very much subjective?
So I do try and ask everyone a sort of scaling questions. So, and this is another thing that can vary, because some people find answering questions of 0 out of 100% very, very difficult to answer. So I might switch that around and try a 0 out of 10, or I then might ask them, well, how would you talk about it? Is it like a middling pain, or a severe pain, or a mild pain? Yeah. So that in some way I've got a sense of what they're experiencing in a way that they can explain to me. I think often with things like the VAS score and things, that are really useful, but there is a cohort of people that it doesn't really seem to work very, very, very well for.
I have a bit of an issue with that, because not with the whole scoring thing, but it's called a VAS score, but we ask people to put a digital answer to it, and I just wonder. It's probably, I'm thinking in my own response to your question, it's hard to put a number on the pain, but maybe I can point to a line and say I'm roughly there.
Yes.
Maybe I can do that more easily. And then you can put the number to it afterwards, or the computer can, or something.
Yes, I mean, that's another element to it. If you have the physical scale as well, that's something I've done previously, not at the moment, because the clinic where I work doesn't have that. But yes, that could be a way as well. And really it's exploring how they can communicate, because the people do communicate in different ways. Some people, for example, are very expressive, and they may sort of pull faces or sort of physicalize the pain for you, but can't really describe it in a way. Yeah. And I think it's important to recognize that element in what the patient is saying.